If you struggle with depression, you know how crippling this can be. You know what it means to no longer have your joy and happiness. You understand the sadness, the lack of pleasure, the decreased appetite, or weight loss that comes with depression. The fatigue, sleep problems, the lack of focus, and poor motivation. That feeling of not wanting to get out of bed and struggling to make it to the end of your day. In some cases, it's also the feelings of hopelessness, worthlessness, and even thoughts of death. About 260 million people suffer from depression in the world today. This mental illness is a real struggle. But it doesn't have to be this way. You don't have to go through your day in a daze. You don't have to wonder if you can play with and enjoy your kids or if you can make your work and school deadlines. You don't have to live like this. What if you could feel better about yourself? What if your depression could be treated and you could smile again? A super common question I get as a psychiatrist is, how do I treat my depression? And I see a lot of misinformation on the internet on depression treatment. So today, I'll be talking about 3 ways to treat depression, including transcranial magnetic stimulation, TMS, esketamine, and psychedelics. So number 1, transcranial magnetic stimulation, TMS. This is a procedure that uses magnetic pulses to treat depression in adults. TMS is done as a day treatment in a doctor's office. It involves applying magnetic fields to specific parts of your brain that affect your mood and cause you to be depressed. This process helps your brain cells release chemicals that make your depression better. So how well does TMS work? Studies show that approximately 50 to 60% of people with depression who have tried and failed to receive benefits from medications experience a clinically meaningful response with TMS. An entire course of TMS treatment is 36 sessions. Treatment is done 5 days a week for 6 weeks with a slow taper over the next 3 weeks. Each session lasts about 20 minutes. There is a faster protocol called theta burst, which lasts only 3 minutes. You're not put to sleep during TMS therapy. It is a safe treatment with minimal side effects. You may experience headaches, dizziness, and tingling in the face. Severe side effects with TMS are rare. Seizures can occur if you have a history of epilepsy or other seizure disorders. If you have bipolar disorder, it can also cause mania. Number 2, esketamine or Spravato. Esketamine, also known as Spravato, is a relative of ketamine. It is a nasal spray medication for treatment-resistant depression in adults. It also has approval for depressive symptoms in adults who have major depressive disorder with acute suicidal ideation or behavior. It improves your mood by increasing a brain chemical called glutamate. Spravato can work quite quickly. It relieves depressive symptoms within hours to days, much faster than other medications used to treat depression. Antidepressants like sertraline, fluoxetine, and venlafaxine can take weeks to act. Side effects of Spravato include drowsiness, nausea, vomiting, spinning sensation, high blood pressure, anxiety, and reduced sense of touch and sensation. Another common side effect is feeling disconnected from yourself, your thoughts, feelings, space, and time. This is known as dissociation. Some describe it as an out-of-body experience. Others may have dizziness, suicidal thoughts, feeling drunk, and problems passing urine. Spravato comes in a device containing 28 milligrams of esketamine. The prescribed dose is either 56 milligrams or 84 milligrams. From weeks 1 to 4, you get Spravato twice a week. From weeks 5 to 9, you get it once a week. From weeks 9 onwards, you get it every 2 weeks or once a week. Spravato is only given in REMS certified treatment centers. It cannot be taken at home. Before each dose, avoid eating for 2 hours before and do not drink any fluids 30 minutes prior. The treatment center will monitor you for 2 hours after your dose to ensure you have no side effects. Also, you can only drive the next day following a restful sleep. You should avoid taking Spravato if you have any of these four conditions: aneurysm, arteriovenous malformation, history of bleeding in your brain, or allergy to ketamine or esketamine. Let's go on to number 3, psychedelics. These are drugs that can temporarily alter your mood, thoughts, and perceptions. Examples of psychedelics are LSD, DMT, psilocybin, MDMA, and mescaline. In the US, psychedelics have not been approved for treating mental disorders as at the time of this video. There are, however, several ongoing research which have shown promising results with psychedelics. Some doctors also use these drugs off-label to treat depression, even though they're yet to be officially approved. Psychedelic therapy shows promise in the treatment of several mental health conditions. In a later video, I'll talk more about the positive studies on psychedelics and mental health. Thanks for listening, and subscribe for more up-to-date information on mental health. Talk to you soon.